Cardiovascular disease is the #1 killer around the world. And this week, it took the life of rock legend Tom Petty. 66 years old, he was rushed to the hospital after being found unconscious at his Malibu home. Not all heart disease is the same. Sometimes it can require long-term treatment. Other times it comes on suddenly and seriously. Joining us here on the morning show is St. Vincent's cardiologist, Dr. Ragu Murthy. Thank you for being here. Let's delineate first the difference between heart attack and cardiac arrest. One involves the muscle, the other is electrical.
Well, yes, in a short answer. So basically, a heart attack is when there's lack of blood flow to the heart, and that can actually result in a cardiac arrest. There are other things that can actually result in a cardiac arrest too, which are just straight electrical, or it can be due to many other types of issues that can result in the heart stopping. But cardiac arrest in itself basically means that the heart results in stopping or is unable to pump forward blood, which kind of makes you understand why there's such a very high mortality once a patient does experience cardiac death, because time is of the essence. And most patients, if you end up not getting enough blood to the brain ends up dying, and that's what results in a person's death.
And I was going to ask you about that, because we heard that Tom Petty was found unconscious in his Malibu home. We don't know how long he'd been there. Had somebody attended to him earlier, the outcome could have been different.
Right, and that is not an uncommon finding that we end up seeing in cardiac arrest. What we oftentimes end up seeing is that patients are found down for a long period of time or an unknown period of time. And so because of that, you don't know how long their brain has been lacking blood flow. And that becomes oftentimes the main issue when it comes down to cardiac arrest. The brain is the most sensitive organ to a lack of blood flow, and when your heart is not pumping forward, that is the primary organ that gets damaged.
Symptoms that tell you got to get the plumbing fixed.
Correct. So some symptoms, about 51% of patients in the 4 weeks prior to having a cardiac arrest, in some studies have shown that they actually had symptoms leading up to that. So those symptoms, in males, it's primarily some sort of chest pain or chest discomfort. In women, it's more of shortness of breath, in addition to some chest discomfort. Unfortunately, those signs are also what we call non-specific. They're not specific to cardiac arrest. You could end up having chest discomfort after you end up eating a greasy sandwich. So that doesn't necessarily mean it's related to cardiac arrest. There's no real good signs or symptoms that can really point towards this is what this is.
But guys don't go to the doctor. But if you have something that you think may lead to a bigger problem, you got to get it checked out.
Absolutely.
Basic lifestyle changes mitigate some of the risks?
Yeah, so, as far as risk factors associated with cardiac arrest that you can control, #1 is quitting smoking. Very important to quit smoking. It is directly linked towards cardiac arrest. Other things that are actually very important that you can potentially do is if you are an excessive drinker, that actually is related to cardiac arrest. Sedentary lifestyle is related to more cardiac arrest. And actually regular exercise results in a reduction in cardiac arrest. Addition to that, a good diet with more of the Mediterranean style diet. So, a diet that limits red meat to about 2 times a month, high in fish and poultry, and nuts and extra virgin olive oil. That would all help in reducing cardiac arrest.
Could make a difference between life and death. Doctor, thank you very much for being here.